Well, up to 40,000 National Guard soldiers could be forced out of service if they do not get the COVID-19 vaccine by this Thursday. That makes up about 13% of the force. And states are saying that they're doing as much as they can to get shots in those arms, but there is that deadline looming. So, my question with this is, what is the point of this? I mean, we know that these COVID vaccines are not stopping the spread. We also know that, yes, they do help people prevent severe disease in people that are at high risk, but most of these soldiers are, under the age of 40? I mean, retirement is 20 years. They start at 18. So,
and they're in good shape, right? Don't they have to be in the National Guard?
We would hope.
National Guard is not exactly the same thing as the military. I will say that the list of mandatory vaccinations for service members includes adenovirus, hepatitis A and B, influenza, measles, mumps, rubella, meningococcal vaccine, poliovirus, tetanus, and varicella. I don't know what some of those are, but tetanus similarly, it only affects yourself. It's not like they're going around spreading, you stepped on the nail or whatever in the field. That is what it is. But the military then has to pay you while you're getting well. You're not able to work. They have to provide medical care for you. That's a cost to the government. It's a cost to your ability to actually be productive. And so there's a reason why people are asked to get these kind of vaccines to serve. And for clarity, although there are 40,000 National Guard soldiers, only 14,000 have refused the shot so far. And when it comes to military personnel, the numbers are much lower, with only people in the 97% of the military is fully vaccinated, and those who haven't have been allowed to be generically discharged with benefits, and they can come back as soon as they get vaccinated. So, I mean, is there a distinction between something like a tetanus vaccine and something like a COVID vaccine, if it is true that the COVID vaccine still helps you not have as bad symptoms and
that's
makes you
really
more
proven.
likely to come back and to serve?
Yeah, that's not even. I mean, we don't. People are still getting sick. They're still taking time off work. I mean, sure, if you're 25 years old, 30 years old, you're probably not going to end up hospitalized, vaccinated or not. That's just the reality. That's the science of it. But, the people that are vaccinated, it's not like they're taking off less time of work. They're just they're sick. They're sitting at home. They have to wait till they test negative. They can't come in anyway. Even if they're asymptomatic, they can't. So, as long as they're testing positive. So I don't even know what the argument is for that of, well, it's because we want you back to work. And so therefore, for your boss and for the government, you better get this so that we don't have to deal with your sick self. That's not even, if you're positive, even if you have the sniffles. They won't let you come back in.
I mean, in this case, right, in this case, the bosses are us, though, right? In the National Guard, it's their salaries are funded by taxpayers. So, with government employees, my stance on this has been, they work for us, so we get to decide, what the standards are for their employment. So in theory, I'm more willing to have them be vaccinated. But like you, Kim, I just don't really see the point. If some people, it's a minority, obviously, of the National Guard, it seems, really don't want to get this vaccine, what is the upside to making them do it? Because as you note, it's not really about controlling the spread of COVID, and they're not, likely to be in a severe risk category. So I just can't. I think the onus, even though it's possible to do it, because again, the government employees, they work for us. But what is the reason ultimately that you have to make someone get it who doesn't want to get it? And I just don't.
The reason is that getting a vaccine makes it more likely that you experience less severe symptoms than people who are unvaccinated. So obviously you can't come into work whether or not you were vaccinated or not if you get COVID. But the idea is you're not out as long. You don't have the severe symptoms, and of course there's a less risk of hospitalization, which again takes you out for longer and is something that the military has to support you through if you're unvaccinated. And it's the same, is the argument then that people shouldn't get any of the other vaccines that are required by the military as long as the only impact is on the soldier themselves and it's not something that's communicable?
Well, the other vaccines are actual vaccines that usually stop the spread of the virus. So that is the difference. The COVID-19 vaccines.
Many of these vaccines aren't about viruses at all, like the tetanus shot.
Sure, but the tetanus shot does protect you from having a poison run through your body, if you were to step on a nail, for example. So there is something, sure.
And the COVID vaccine prevents you from having worse outcomes and worse incidence of COVID, but worse symptoms.
Only in certain groups, but you have to be specific. You'd have to be specific about that. That's like treating it like it's a blanket. Everybody has the same risk factor. We know that that's not true. That is just not true. People over the age of 65 have a very high risk factor. So of course, for them, taking the vaccine has helped reduce hospitalizations. Also in men, particularly men who are hypertensive, it also does help reduce the risk for them. But we're talking about younger people. I mean, people serving in the National Guard are typically younger. I think there is an age cutoff, and retirement is quick after 20 years or so. So, we have to be more specific about who these risk people are. We can't treat it like a blanket. Everybody is in the same. And so if you get the vaccine and you're 25 years old, your risk of hospitalization goes down from practically nothing as it is. So I think that distinction matters. And then to kick out potentially 13% of the force over it.
What would you make of the argument that, people in the National Guard, right? It's not like other categories of employment, like our military or National Guard, right? They're supposed to be following orders they're given, right? And if there's some of them who have this
this is insubordination. I'm sorry, and I don't think it's an
authority
accident.
In this way.
The military has complied. Our service members have complied, and it's very interesting to me that it's the National Guard who have apparently in larger numbers chosen to rebuke their orders when it's only a few hundred people in the Air Force, a few hundred people in the.
Too bad, you work for us, right? Sorry.
I mean, my viewpoint on this is I take the more progressive viewpoint on this. People are forced into the military service because they're poor. They are largely recruiting from poorer families because they don't have the means to go to college. They don't have they need to support their families. They're more dire in their economic situation, so they often join the military. Just because a person is poor and they've been forced now because of a lack of economic means to join the military, does that mean that we own their bodies, that we should? Yes, we do, I guess. We do. We can send them off to war and force them to die
I don't want there to be a military at all. I don't want there to be a military at all. But
so then why would you argue that if you're in the military, then therefore, you are insubordinate. This is insubordination, and you must do all of these things, X, Y, Z, because we said so.
I didn't invent the military. It is insubordination to not follow orders. I didn't invent that reality. I'm just pointing out that we have a Navy which has discharged 798 soldiers, or 2% of the fleet. To date, 99% of the active force and 93% of the overall force is fully vaccinated. This is an interesting contrast between what's going on in different parts of the force. And my concern is this. We're talking a lot about the potential, like what is the upside of COVID, when I think also there has been a misrepresentation about what the downside of COVID is. And I will say this. I am someone who has been plenty skeptical in her own personal life, who has had long considered conversations with family members about the cost-benefit analysis. I have never come out in favor of mandates once. However, I don't want to misrepresent or have a one-sided view of this issue. And the reality is, I think there's a double standard for COVID versus some of these other vaccines because of the way that COVID in particular has been politicized. I don't particularly want people lined up, forced into a military, forced into war, or forced to take any kind of vaccine. But I'm having a hard time distinguishing between how we're treating the COVID vaccine and how we're treating tetanus,
maybe in this case,
measles,
rubella. Maybe it's fine because there aren't tons of people saying, I don't want to take the tetanus vaccine. And if there were, I would go, okay, maybe if we have to think about what is the reason to make you do something you don't want to do? Is there this very compelling reason?
Let's cancel
and a lot of people don't want to do it.
Military.
So I don't know why I would I'm willing to make them because it's the military. It just doesn't seem like there's much reason to.
This has been the problem with all of this COVID discourse. Everyone's if you had there are people who have consistently not wanted to get their kids vaccinated to send them to school, who have consistently been part of an anti-vax movement for years. And if you similarly feel that same way about COVID, hey, I may or may not agree with you in a particular instance, but that's a consistent worldview. What is happening right now, I'm sorry, with the way that people are talking about COVID has very little relationship to that ongoing concern about what's been going on in these vaccines. This is, I'm sorry, a very politicized conversation as evidenced by the fact that people who ordinarily would want law and order and respect for the military, who would look at people who didn't want to follow orders as deserters, who would think that obviously you have to take all of these other diseases to be active in the field and doing all of these kinds of things, are having an inconsistency in their worldview when they now say, oh, this vaccine is a problem. That's all I'm pointing out, not advocating for anything one way or the other. Why can't we just let them do that?
They don't want to take this vaccine. They're a minority of the people, even in the National Guard. why make them do it, I guess?
Well, they don't have to, and they can resign. We don't have forced conscription at this point, and they can resign.
Yeah.
Well, lose their job. I mean, that's kind of a hefty penalty for not wanting to take something. I would say, Brianna, to your point, first of all, regarding the military and why 97% of the regular military versus the National Guard is a different service, and a lot of them are not full-time. So a lot of them are working regular jobs. They have regular families and lives, and then they go and they serve the country in the National Guard. So it's a little bit of a different system. It's not like they're being deployed off to Germany or Japan or some other, or war. So it's a bit different. So I think there's more hesitancy, I would say, in the National Guard, because there are more regular, normal people, I would say, living normal, regular lives. Secondly, to your point about why be inconsistent and say you don't want to take this vaccine when you're forced to take other vaccines, that comes down to science, and that comes down to the actual data. So people are looking at the data, and they look at something like polio vaccine or measles vaccine or even the tetanus shot, and they see that the rate of prevention of those diseases is high, even if it only is a disease that affects yourself, like tetanus, and it doesn't spread to others. Nonetheless, the vaccine actually does work. We're not seeing that. The evidence has not been there. They said to us over and over, you get this vaccine, you won't get COVID. That was a lie. That didn't work out.
Right, but
it didn't work out the way they
thought. Now, Kim, we know that it doesn't. The claim that no one here on this panel has ever made the claim that if you get the vaccine, you won't get COVID. This is a conversation about whether the military has a reasonable, calculated interest in asking people to take a vaccine that, in many cases, not marginal cases, in many cases, lowers your the severity of the disease once you get it. A disease which, to your point, the point that both of you make frequently on the show, is very common. Everybody gets, sometimes people get more than once a year, and has a debilitating effect. You guys have both had COVID. You know, it's like no cakewalk. People have friends that I have had who've gotten COVID say, guys, don't get this. I thought it was going to be just like any other flu. People obviously have different symptoms, but I feel like to the extent that there's an argument that the military should exist and should be forcing people to get any number of vaccines, I am struggling to see why it doesn't have a narrowly tailored, calculated interest in making sure that its service members are out of commission for as little time as possible.
I mean, I would say to that, there's no limiting principle, however. The government has shown no appetite for limiting principle. If it was just, to be in the military, we make you take all these vaccines, this is another one, I guess I would not have, I don't have a big problem with it either way. I see that argument. I also not sure why I need to force these people if they really don't want to do it. But there's been no limiting principle. It's gone all the way down to, children have to wear masks, the least at-risk populace forever.
There's no more mask mandates. How long are we going to talk about? But wait a minute.
No, but it was anti-scientific for a long stretch of time.
And you guys made the case. People kept it. People made the case, rightly so, and now there's no more children's masks, and you won at the Supreme Court, and there's no mask mandates. So I'm just really curious, how long are we going to gin up a lot of anger?
It's not ginning up. They did it. They did it for a year. It's not ginning up.
Okay. So
they canceled school for 2 years.
I just want to know. So 2 years from now, assuming there's no new mask mandates and there's no kids that are asked to be
masked. It's already done. I will never allow a vaccine mandate because they didn't say just a vaccine mandate. They kept everything else in place.
Are we still going to be talking about how authoritarian it is that in 2021 there was something that you didn't like? Because it does seem to me that there's a lot of. I'm sorry, I gotta say this. There's a lot of political traction.
It was by far the most authoritarian thing I have ever gone through in my life, and for lots of families and difficult.
That's a blessed life you've led, Robbie. If that's the most authoritarian thing you've ever gone through, because
it wasn't a blessed life for kids.
The Supreme Court just stripped my ability to get an abortion. So I have a little bit of a different perspective that you have in terms of bodily choice.
I guess 2 years from now I'll say, well, no big deal.
I mean, look, right now, to your point, Brianna, I understand we can't be angry forever, and hopefully one day we do get past this. The military right now, this National Guard issue, these people are facing a mandate, and that mandate deadline is tomorrow. So that is real for them. Mm-hmm. It is something they are facing. That is very authoritarian in my view. And so that's a reality for some people. I guess my question back at you, I know we're short on time here, but my question back at you is where is the limit for the military then? I mean, if you're going to label anything and everything a vaccine, at this point, seems like you could just theoretically label anything a vaccine, even if it doesn't stop the spread. You could just say, but it'll limit your symptoms, maybe. And so if that's the case, we're calling it a vaccine.
It's not just vaccines. The military constrains your life in myriad ways.
I mean, that's what's odd about that. conversation
many
because
of
the
which
military
I don't
does
agree
get
with.
forced to do a lot of
to
things.
your point earlier,
That's the
Kim, I'm
military.
really glad you asked me this question. To your point earlier, I completely agree with you about the people who feel constrained to be in the military, that it's so many vulnerable populations that are overrepresented. There was an article that people were passing around recently that was very openly saying we can't cancel college debt or make college free because otherwise they would never be able to recruit people to the military. That's disgusting to say we're going to use that as a constraint. People join the military to get education and for healthcare. Those are the two biggest reasons. My best friend served in the Navy for 8 years and the reason was education, right? So I feel very strongly about this, and I would rather address the issue on the front end and make sure that we don't have people being coerced into the broader coercive project that is the military industrial project, and not just the narrow conversation about COVID. But I think we're largely in agreement there.
Right, but I guess where I draw the line is I say, even though they've signed up for the military, they've signed up to fight and die for the country. That doesn't mean I own everything about their body and I can command anything I want just because they're in the military.
Sure.
I do draw a line. And I think it's at the war part. I mean, otherwise than that, vaccinations, I would like the military to start explaining themselves as they are saying a variety of things on our military members, not just medicals and vaccines, but other things that they require of them. It doesn't make sense to me, and I think we need to have a conversation about the limits of the military and what they can and cannot command of individuals.
Well, I think we could have continued this conversation for quite
Forever.
a while, but I'm hearing we got to go, so we'll leave it there and have more Rising for you in just a minute.